If your lower back feels sore, then massage this area with the second joint of your index finger. Press down firmly. Count 1, 2, 3. And then rub it gently, and the patient will feel much better after that. However, treating this zone alone is not enough. You have to massage the zones for the hip joint as well as the coccyx in order to be effective. Now, the method to massage this is exactly the same as the way we did it with the inner side. Use the tip of your thumb to massage the hip joint zone. Now, this area is very sensitive. Use the second joint of your index finger to massage the coccyx zone. In between these two zones is the zone for the testicles for men, or ovaries for women. And then in the direction of the front of your foot, we have the reflex zones of the oviduct for women and the sperm duct for men. It is very common for city people to experience problems in the sciatic nerve. The reasons for this are because the seats that they sit on are not suitable, or they're not sitting in an upright position, or they may have been sitting down for too long. This could bring on a lot of pain. Foot reflexology can give them a lot of assistance with this. The pain in the sciatic nerve is often caused by taking too much pressure on the back and the lower back. Very often it affects the way we walk. Now look, the sciatic nerve runs from the back of your knee all the way down to the foot. And it ends right here. So what we do is we massage along this line on the leg, just like this, you see. That'll help to relieve the pain. Make sure you emphasize and apply the most pressure where the zone ends, right here. Now you can apply a lot of pressure. Remember, do both the outside and the inside of the leg. This is very important. This method also applies to the inner side of the lower leg. Now, the thickness of our inner sciatic nerve is very similar to the size of our baby finger. However, if you apply pressure, it turns into the thickness of the size of your thumb. And when you first massage this area, the patient will feel pain. After repeating this several times, then the pain will subside. I believe that this method is very effective in treating people with back pains. And now we introduce the reciprocal reflex zones. They are hand to foot, wrist to ankle, forearm to lower leg, elbow to knee, upper arm to thigh, shoulder joint to hip joint, and shoulder girdle to pelvic girdle. Now then, if your big toe is hurt, please do not massage it because you're not supposed to. Instead, you should massage the correct reciprocal reflex zone for the big toe. Now that is in the thumb. Another example is if your left ankle is hurt. Then the reciprocal reflex zone is the left wrist. The same bone that you have in your foot, you also have in your hand. Look closely. Here. See? They are the same. Now, as long as you look for the correct reciprocal reflex zone, you'll be able to ease the pain.